Hello, everyone. Thank you for being here today at the GeekyAnts Meetup on Interoperability in Healthcare. My special thanks to our audience and speakers who have joined us from outside India, especially from London and Florida. Thank you very, very much. Uh, I'm honored to have become your keynote speaker for this evening today. A very, very warm welcome to each one of you who have joined us today for this healthcare meetup. I am Pramada and I lead digital healthcare program and business growth at GeekyAnts. Before we delve more into interoperability and its exciting world about interoperability, let me share a brief story with you. One of my uncles became unconscious a few months back. We had actually immediately rushed and admitted him to the emergency department. Fortunately, he was wearing an Apple Watch, and his healthcare provider could actually transfer his ECG reports to his medical device, and we could find that an hour back he had a cardiac arrest. Without any further delay, he had to actually undergo a heart surgery. That is where interoperability helps. We could actually save his life with a better data, and also the decision making was quite fast just because the data could be transferred and we could analyze that he had a heart attack some time back. That is the goal of healthcare interoperability. The goal of healthcare interoperability is to connect healthcare systems electronically to facilitate electronic share of data. It actually provides a common language to communicate. For today's meetup, we are mostly going to focus on four important topics, which is around healthcare data exchange architecture, application program interfaces, the policies around this, and also, very importantly, the healthcare standards. Moving on, it is very, very important for us to know why interoperability. Why are we talking about this? And why is it that important? We all remember during COVID-19 pandemic that home-based care were given to the patients. And patients with the chronic disease, it became very inevitable for them to stay at home and get their physiological parameters tested and pass it on. They could actually do this with the help of medical devices. They could transfer their physiological parameters wirelessly to the healthcare providers, and the healthcare providers, by sitting at their home, could actually visualize and take decisions based on the reports that they have received from the patients. That's why it is very important. What does it do? It improves patient safety. It gives more accurate reporting. It gives better access to complete patients' health records. It also reduces errors and improves efficiency. That's why it is very important to understand interoperability in healthcare. Okay, so we are going to, as I explained about interoperability, what is the standards? Okay, so interoperability actually requires standards. Standards give the frameworks to facilitate the secure exchange of data between disparate systems. We have different organizations. It was first started by Health Level 7, which has actually given a set of international exchange standards for sharing data between healthcare providers. Another healthcare standards which actually emerged from HL7 is the FHIR, which is Fast Healthcare Interoperability Resources. Nowadays, we're talking about DICOM, which is again similar, but this standard focuses more on images. During this entire next 2 hours, we are going to focus more on the standards, and we will have some perspective around how FHIR data is exchanged and transferred in the particular format. Okay, moving on. Why Geeky Ants and what we are doing here today, and how Geeky Ants is taking part onto this. In past, we have actually done a very, very exciting POCs and engagements with our client, where we have actually stored patient data in FHIR standards, which has enabled patient to access data using secure channel. The secure channel is very important. So we apply some compliances and all that, which our speakers is going to talk about that. Also, another very exciting work that we did is the automating the process of transferring patient data from one payer to another if a patient wishes to change his payer, which is the insurer. Also, we have integrated with the platform which expose data in HL7 formats to send any new activity notifications about patients. With this, actually, data decision making has become very easy for the healthcare providers if they get if there is any change in the patient data. This one we have done already. Apart from this HL7 and FHIR standards, we have done in healthcare projects with our clients and which has been actually going on. We have worked on the teleconsultation applications. We have built customized solutions for our clients where they have been using our modules to work with the patients and book their appointments. We have worked on patient portals. We are actually working on a data decision platform. Another very important POC which we are working on is AI driven medical coding. And AI in healthcare is something very, very important, which our speaker today is going to talk about that. So, moving on, let's not waste our time. I would like to quickly introduce all our speakers for today who has given their valuable time to join us today. My special thanks to, so we have Dr. Anuj. Thank you so much, Dr. Anuj, for joining us from Medanta Medicity. He is going to talk about interoperability in diagnostic labs. We have Ruben, who is going to talk more about fire interoperability, mostly on the US perspective and compliance. Our expert Abhishek Anand, he is going to talk about export fire and convert fire. I just love his presentation. And a special warm welcome to Ravi sir. He is a Palm Power CEO and founder. He will talk about interoperability in healthcare. We have Kapil from Adobe. He will talk about 10 benefits of artificial intelligence. We are quite excited to have our thought leaders for today on this meetup. Thank you so much. Over to you, Sana. Let's get started.